is going on, everybody? Welcome to the latest episode of The Legislative Director, talking about legislative things. Here she is. We're not in the same place, but she's there. She's doing her thing. Amber Marr, how are you?
Good. I'm good. You're quarantined.
I am, as not the legislative director, we're doing this kind of what we did years ago during pandemic's time. I am under the weather, I believe is how we say it nicely. You don't need to know the details. I'm feeling better, but I was not there this entire week, if you will, at the office because, yeah, not feeling great. Not feeling great. Uh,
But I'm glad that you're feeling better.
I appreciate that. I'm glad I'm feeling better too. Sorry I missed out on all sorts of fun this week. That I think let's just dive into it. Let's talk about the fun that's been had. Well, some of it is fun and some of it is fun at the state and things of that nature. So the first
Yeah.
thing, this is legit fun, is we had a little event to talk about mobile integrated health and to premiere a video that we've made, short film, whatever you want to call it. So why don't you talk a little bit about that event that I unfortunately had to miss, but you were there for, and it was a great event. It's good legislation. Let's talk all about this mobile integrated health action.
Yeah. So we, over the past year and a half, and I know we touched on this in the last episode, but we have been really trying to elevate, support, find ways to engage in these programs to continue to talk about what they do and to provide sustainability. A lot of these mobile integrated healthcare programs are run through grants or other ways through local hospitals that might be partnering with these programs to help them continue to run. Some areas do provide a dedicated fund from that community to help these programs, but that is very few and far between. So we are really trying to get the word out so that folks understand what mobile integrated healthcare actually is. And I think last night was a perfect opening to that because of that video that we took. I want to say it felt like a long time ago,
The
but
end of May, I think.
yeah, and we've been waiting for this to do this release, and it just so happened that luckily the timing did work out because right now in session there are 3 bills that are going through the legislature around mobile integrated health and ways that we can sustain them and allow other communities to get up to speed on what this looks like and maybe get some thoughts from the other programs that are working amazingly and then find ways to do it themselves. So it's Senate Bill 142 and then House Bill 1378 are the 2 main bills around removing the fact that mobile integrated healthcare programs can bill commercial insurance beyond actions happening from a 911 call. So right now, an individual has to call 911 and have that mobile integrated healthcare program go and help them in order for them to be able to recoup those costs on what they do. And that's
Yeah,
actually,
go ahead.
oh, sorry.
No, sorry.
No, go ahead.
No, I was going to just for folks who maybe not know, we explain just a little bit more mobile integrated health?
Oh, yeah.
What is that? I guess I just want to make sure that folks know.
Thank you. I don't know that we actually. So I'm actually going to read what is on the Department of Homeland Security webpage because I think it's really great. Cool. But mobile integrated health is a patient-centered model of care delivered in a patient's home or in a mobile environment. This includes teams that come to patients as well as the use of telehealth platforms. Community paramedicine can visit patients at their home and assist with health screenings, vaccinations, treatments, and follow-ups. MAH can also include social work, substance abuse resources, mental health, chronic disease management, and more. So I think Nick, who is in the video, who you will meet, and we're so excited for you to see that program. But he talks about it. Literally, it's like house calls. Like it's basically having someone come to you and help you where you are, which from an ARP perspective is being able to allow folks to stay in their homes and communities for as long as they choose. And that is something that we really want to highlight and continue to talk about.
Yeah. Perfect.
Yeah. So I think one of the things that we just wanted to explain is that also we wanted to talk about that Senate Bill 10,
Mhm.
although it's a different type of a bill for mobile integrated health, it is sort of trying to create a fund for folks to apply to get some of that startup money, or if you already have a mobile integrated health program, to grow it. And so it is a little bit of a different angle on sustainability, but still sustainability nonetheless.
Awesome.
Or not just sustainability, but also helping communities that don't currently have these types of programs get
Yeah.
engaged.
Cool. And then so there's that Senate Bill 10, Senate Bill, I've already forgotten the name.
142.
142. And then House Bill, there's a House Bill for this as well, I believe.
1378.
1378. Okay. Before this session's over, I'm going to know those numbers.
Well, I don't know. The session's going so fast. I feel like there's just not enough time to learn the bill numbers. So that's what I'm going to say. I'm hoping that we can get a hearing and get it passed before we actually can, put the number in our brain.
Yeah. Perfect. All right.
So last night was this huge unveiling of the video around mobile integrated health and explaining what this is and trying to find a way for folks to easily digest what these programs do. And this is just one program, right? This was about Monticello. It was about what they've done. It's how they've mirrored it after Crawfordsville's program. And so I just think it was a great group of individuals from all across the state that not only are have created mobile integrated health programs, work in those programs, or are looking to start their own program in their communities. So we had legislators, we had mayors, we even had a couple city councilors there watching the video. We had a lot of folks there to take part in this celebration, but also a time to talk about how we can expand this type of a program across the state.
It sounds like it was fun. It looked fun from the photos I saw. I think for those of you that are watching, there's the famed
That's
that's
Nick.
Nick right there, who you'll see in the video. Good dude, just doing great work in Monticello. So that's good to see. And then also for those of you that are watching, there's a giant QR code that is now on your screen. If you're watching this on your phone, it might be a little bit harder to do. If you're watching it on your computer, scan that thing. Either way, for those, if you scan that, that'll take you to our website where the video resides, as well as some more information about all the bills that Amber just talked about. For those of you that are listening, go to aarp.org/in and you will see healthcare the Hoosier way is the what you're looking for. You click that link. That will send you to it. You can also find the video on our Facebook page. It's on our YouTube page, all those places. But arp.org/in, and then look for Healthcare the Hoosier Way. We'll get you there, and you'll see some good stuff. And then also, as bonus content for the folks that are watching this right now, after we say our goodbyes until next time, we are going to roll that video. So stick around to the end, and you will get to see the full video in all its glory and see the good work that's happening up in Monticello. Once again, for those of you that are listening, let's switch that up and watch something and watch this video when you get the chance to see some of the good work that's happening around mobile integrated health, especially in Monticello.
And Jason, I wanted to bring up one other thing because Chief Miller always explains it like this. The piece about the 911 that, in order for these programs to bill commercial insurance, it has to be initiated by a 911 call. He speaks as to why this is important that we remove that it has to be initiated by a 911 call is because the whole point of mobile integrated care is really preventative instead of reactive, and trying to, we don't want it to go to homes when people are in those crises. We want to prevent that from the beginning so that we are keeping them from ending up in that situation.
Yes.
And so that's why it's so important that it shouldn't just be when it's from 911, because we are hoping to keep them healthy enough to where they don't have to call 911. So,
Yep. Love
yeah.
it. Good work on the event. Just good work on this legislation. Good work on the video. Look, just great work all around. So
And also, sorry, I keep thinking of things to say, is that another amazing piece to this, these types of programs is when you look at it, it really is supposed to also keep folks from being readmitted to the hospital. So if they're being released, usually there's a very high percentage of individuals who, after being released from the hospital within 30 days, they are readmitted to the hospital again. And so a lot of these programs are connected with those individuals that are being released from the hospital, and they get to keep them from having those readmissions. So it also saves money on the back end of the high healthcare costs that can happen when you are rushed to the emergency room again after being released. So that's another important factor.
love it all around. Hope you all take a moment to at the end of this to watch that or seek it out on your own and take a look. And like I said, it's a great program. Hear from people that are you have utilized it and just kind of the connections that are made and things of that nature. It's just good stuff.
Sorry, one more thing. Senate Bill 10.
Yes.
I think I said Noblesville. I don't know if I did or not, but that is Mayor Jensen's sort of initiative because, yep, thank you, Dan. Community Cares Initiative Grant Pilot Program, because they are doing a lot around mental health, behavioral mental health, substance abuse, etc. So they're using their mobile integrated health program right now with a large focus around mental health care. And so I wanted to say, we talk about this all the time, but the greatest thing about mobile integrated health is also that communities can sort of design it whatever their community needs. So that is what we always love to hear is, when you meet a community, it doesn't mean that the community next door needs exactly what that community
Yep.
needs. So everybody has different needs. So yes, so I wanted to mention that that's what Senate Bill 10 was and where that was coming from.
It's versatile in its care options, and so
Yep.
that's great. All right.
Awesome.
Well, for sure, like I said, healthcare the Hoosier way. Check it out, arp.org/in, or just stick around to the end of this video and you'll get to see it there as well.
And thanks to everyone who came yesterday. It was just so great.
Awesome. Well, now we're into the fun part, quote marks, part of this discussion is what else took place at the State House this week. Specifically, we're recording this on Thursday. Today, Senate Bill 52.
Yes. Senate Bill 52. Prohibition on use of dedicated lanes. As everyone knows, ARP, we fully support transportation and the build out of transportation systems. So, Senate Bill 52 is specifically attacking the Blue Line here in Indianapolis that is soon to be built, and it is using dedicated lanes. This bill would prevent that. However, it was heard in appropriations today. There was a very long discussion, individuals on the support side, individuals on the opposing side. There was a wonderful turnout of citizens, businesses, etc. There was an amendment added that Senator Freeman talked about at the beginning and then sort of throughout the committee hearing. And what the amendment did is that instead of prohibiting dedicated lanes, it actually would put a moratorium on it for a year, which means no transit system could have or build out a dedicated lane for their transportation system over the next year. So it wouldn't be forever, and it wouldn't impact the current red line in Indianapolis or the purple line that is currently under construction in Indianapolis, but it would affect the blue line and then any other transportation system statewide that could have been thinking about doing dedicated lanes over the next year. And the amendment passed and it went into the bill.
Okay.
And then, after a lot of individuals testified in opposition, the bill passed out of committee, still 7-5.
And is there anything else that goes with this year moratorium? Like
Oh,
is there anything that like that's supposed to? I guess what was this is going to sound. Well, I generally don't know things. What's the point of that?
yeah, I think what was stated that the point was is that, there is the availability of more time to talk about
Okay.
things that dedicated lanes create barriers for,
Okay.
but
Okay.
also on the flip side, time to talk about what dedicated lanes are good for.
Okay.
I would say that if that stays the way that it is, from my understanding, the moratorium would still affect the blue line as it stands, because the build out is supposed to, or the construction is supposed to start this year. So if this moratorium goes into effect, I think we might run out of time on the grant that we've been promised if we finish. I
It's the same result as if you just outright banned it, basically. Like the blue line still
Yes,
doesn't happen.
that is what my understanding is.
Okay.
So, while AARP did not testify today because there was a time limit
Mhm.
on how, thankfully, Senator Mishler, and we are grateful for this, he had only allowed I think at the beginning he originally said an hour for each side.
Mhm.
And then as things kind of started, he kind of took that down to 30 minutes aside. But then he actually did let everyone that had signed up testify. And they were on a very limited time. So we are grateful that he continued to take testimony even beyond the time limit that we were given.
Mhm.
So while we did not testify openly, we definitely submitted our testimony in written form. We really wanted citizens and riders and business owners to really
Yeah.
talk about the data pieces. I think Senator Mishler, because this was an appropriations committee, is very focused on cost.
Mhm.
What does this look like? What would happen to it? How much federal funding will we lose? Can you reapply? All of that. And I think what was stated today is, if we do not use the dedicated lane, we do have to start over. We can still apply for a grant through the federal government to help with the build out of our system without dedicated lanes, but it would have to be rescored and we would have to essentially start from zero. And there has been a lot of money already spent on the creation and plans of what this would look like already. So that's kind of where we're at.
Kind of pressing the restart button if that's the case,
Yeah.
which sets the project back. Who knows
If
if
the
or
project
even
even
yeah, even if it happens at all.
There was a lot of talk today that this would essentially kill the blue line, because I think, I don't, I wish I had the figure off the top of my head, but like 14 million has already gone into,
14
the
million.
planning.
I
I
think
could
that
be,
sounds right.
we'll
It
have to
sounds yeah.
fact check that. But a lot of that, a lot of money that Indigo has already spent on, the plans and talking with businesses and how we're doing this and what this looks like. And we were so close to being finished with that already. And
Mhm.
so all of that money that was spent on that, we can't find that money to start over.
Okay.
So,
Well, so
yep. And
now
just to recap really fast, and then we can kind of move on, because I know we've already been talking a long time. But we did a survey in 2021 that
mhm.
showed that Marion County registered voters did stand behind their belief in the public transit system, and 3 out of 4 support building and restructuring streets and roads to include dedicated bus lanes and level boarding stops. So,
Yep. Folks supported this in 2016 when they passed the referendum. When we surveyed, like you said, in 2021, still that support was there. So
Yep.
disappointing, but it's still, we don't know what's happening. I mean, it's moving to the Senate next, so we'll see what shakes out there.
Yep,
But
it goes to the full Senate. It'll be on second reading as early as next week. And that is where the entire Senate body can add amendments to it. So we'll see. We'll see if any other changes come along, and what that looks like. And then it will move on to third reading for a full Senate body vote.
okay.
Okay.
Well, that was not fun. I guess, I mean, I shouldn't put quotation with it because that wasn't fun. But all right, well, there you go. So I think those were, look, that's kind of the big ticket items from this week that happened. We do have our coffee cart coming up next week. Probably want to get a plug for that. You'll get to see some fun footage and photos and whatnot from that next week. Maybe it'll do a
Tuesday,
live episode. We'll see. Tuesday.
January 23rd.
Is it really the
10 to, yeah, 10 to 3. We are creeping very quickly towards the end of January. I don't know where it went. I don't know where time goes.
I'm checking my calendar because I feel like that just doesn't feel right.
Well, and if you can even believe it, some of the committees this week said it was their last hearing before the deadline, which is insane because next week we do have all of next week. It's just that committee deadline is, oh, I don't have the dates in front of me. Committee deadline, sorry. All right.
Let me see.
Committee deadline's Tuesday the 30th for the House, and February 1st for the Senate is the committee deadline. So the House is already like, some of the committees were like, we're meeting once and we're done. And that was this week for some of them. So if your bill didn't get heard, I mean, next week really is, unless they call a committee on Monday or Tuesday, which they don't normally do, if it's a committee that meets not on Monday or Tuesday, we really only have next week. Because the reason why I'm saying that is because insurance, which is Representative Carball's committee, that is where House Bill 1378 went. So we're really trying to get a hearing, but next week they meet, and that's going to probably be their last hearing unless he calls an additional hearing on Monday or Tuesday, because that's not normally the day that insurance meets. Inside baseball. Okay, yeah. We're getting a little into the weeds.
Yeah, we're getting into the weeds here. But look, this is, as they say, how the sausage is made. If you're into meat that's stuffed in animal feces.
I was like, if you're into sausage?
I don't know it. That's just what people say. Look, it's been a rough week in more ways than one. Yes. So we'll stay tuned. Coffee Cart's going to be fun. We're going to talk to a lot of folks, and you'll see footage from that and whatnot. And we'll talk about that more next week. Okay. Amber, great work this week. Great work, as always.
Thanks. You too.
I don't know. No, I didn't do anything.
From the confines of your home.
Yeah, I did. Yeah, I don't know. That's all I'm just going to keep on saying is I don't know. I appreciate that, though. Thank you. Okay. So for those of you, we will see you all next week on the Legislative Director talking about legislative things. And stick around, because here you go is Healthcare the Hoosier Way, our video highlighting mobile integrated health. Let's roll it.
Monticello is nestled between Lake Schaefer and Lake Freeman, and Monticello has a population of around 5,500 year-round.
Mayor Gross came to us and said, I have this idea that I saw working in a community like ours. It's called Community Paramedicine, Mobile Integrated Health. I want you to figure out what it is, and I want you to get it in our city. And I said, yes, ma'am.
Kind of gave him a challenge. See what you can do. Learn about community paramedicine and mobile integrated health. And by the way, there's not going to be overtime. You're not going to get anything, and you better make it work.
Mobile integrated health is important for rural small town communities because it really lets public safety take a step into people's lives and be more proactive. So often we're reactive. You call 911, we respond, and we help with whatever problem they're having. Mobile integrated health can step in and be that proactive person to help them through that issue. Whether how big or how small they are, we can help. We did a pilot program through IU White Memorial's hospital where we took 50 patients discharged from the hospital after their stay, saw them for a minimum of 30 days, and at the end of that 6-month pilot program, we were able to show them a 0% readmission rate, meaning none of those patients readmitted within the first 30 days out of the hospital. Later that year of 2021, they donated $100,000 to be able to start our program. Mobile integrated health has been able to develop and grow organically over the last couple years of us doing this. We've added a maternal and infant health specialist.
What we know is the state of Indiana is currently third in the nation for infant mortality. That is unacceptable.
The program is designed to work with mothers from the time of referral through 4 months postpartum. Mobile integrated health fills the gaps in the challenges of healthcare access in a beautiful way because we are accessible. We grew up in this community, we know this community, and we're able to just be an advocate for these patients and help them to understand what's an emergency and what's not.
It is truly a way that cities and towns, as they're stripped away from resources from big, communities that we don't have, it's a way for us in public safety to step out and say, I know there might not be everything in the world here, but we're here and we can be that bridge and connection to be able to help you as you age in place.
Come in.
Hello, how are you?
Oh, good to see you.
Good to see you
Thanks
guys
for
too.
coming.
Hi, Nick. Hi, Skip. How are you today?
Meeting Nick was a real joy because it's like family, On the Sunday morning, and I had gone to church, he was going to join me. He got the truck out, came into the garage, put the cane in a little damp spot on the floor, and took a fall.
Well, hey, let's check your blood pressure real quick while I'm here. I think one of the most important things about mobile integrated health is being able to slow down time a little bit and show these people how important it is and their healthcare journey to stay at home. Whether it's simple medication reconciliation or blood pressure checks that makes that person feel comfortable, it ultimately lowers their stress. Staying out of the hospital, unwanted medical bills, transportation, all the things that we have in our healthcare journey, what it helps them do is just alleviate all that. And sometimes just a simple phone call or a quick 1-hour checkup with somebody can alleviate all those down the hill problems that we might have in healthcare.
I was kind of bad shape many times, and half hour with Nick, it was gone. It's a personal thing along with a medical thing.
Yeah.
To have somebody that you can call and trust what he's going to tell you.
Rita is a great example of what happens when your loved one is no longer able to progress in their healthcare journey and how we can help that transition into palliative care. So Rita came to us and our program with an aging husband and didn't know what to do next. Nobody out there could help her with what steps were to do. So we helped in that palliative setting, and ultimately through the passing of her husband, we were able to help her from when she no longer needed mobile integrated health. And that is a huge blessing to us through public safety.
You just have to have some help. That's it. There's no way. And I did everything I could to keep Rex at home and not to go into a nursing home. I did everything I could, and they helped me keep him at home. And that's what he wanted to do. When Rex's funeral, they were pallbearers because my husband was very much into that uniform. So I don't think you could ask for anything better than that.
Nick and I in our programs together are able to work toward educating our neighbors in a way that allows them to make healthier choices and therefore be healthier individuals. And healthier mamas, healthier babies creates a generation of healthier adults. And with Nick and his education and support in the population that we're hoping to keep aging in place, it allows them then to be healthier also, because a lot of times the mothers are not only caring for their infants, they're also caring for aging parents. So educating the mother on proper nutrition and what that would look like then has a domino effect both ways, down a generation and then up a generation if necessary.
You know, you hear the term all the time, win-win, but this truly is one of those win-win. None of it can happen alone. We all have to work cooperatively. And now we're looking at opportunities with other community partners, donors, and most especially to try and find a mechanism for sustainability. Let's do that. Let's create a better culture for all kinds of health, from maternal health to aging in place. We will make a difference and improve the quality of life.